Hi, welcome to Fertility Talks. This is our live post number 122. And today I'm really honored to have with us Dr. Sandro Graca. Oh, am I supposed to say doctor?
No, you're not, because it
Okay,
breaks all
fine.
the rules and everything, It's all these rules and regulations.
Yes. Okay, so, and just
Yeah,
so you know, in Canada, at least in Ontario, in the province where I'm from, we're not actually allowed to say doctor
yeah,
as a
see.
traditional Chinese medicine practitioner as well. So it is long-winded. We say registered traditional Chinese medicine practitioner. So what do you call yourself there?
I've been called worse names, Mary, so I'm okay with that one.
Okay, so today's topic is on PCOS and coming from a point of view from a traditional Chinese medicine
Mm,
practitioner, and as well, just looking at it globally, not just in terms of fertility in of itself. And so before we do a deep dive into this, I'll just let you a little bit of knowledge about who Sandro is. And he's based in Ireland, and he's a graduate of the Irish College of TCM and currently writing his MSc dissertation on research in acupuncture for PCOS. So that's really an exciting field because as we know it, there's a lot of people. What's the percentage of women having PCOS now?
it's the highest cause of infertility. So, like in terms of infertility issues, someone trying to get pregnant and not getting there, it is the highest rate. It varies from country to country, and it's interesting part of research as well, seeing that some, I think it's something to do with, there's definitely different races that will have way more incidence of PCOS compared to others.
Yes.
I don't even know what is, should know this, but what is it like for China? But definitely the research coming from China does say that it's a very, very high incidence there.
Hi,
And I
yes.
know from the US, from research from the US, that it is definitely the highest cause of we were talking about this before, because
Right.
sometimes you don't even know you have it, right?
That's right. That's
Yeah,
right.
yeah.
In fact, yesterday I had a woman who did IVF. She was 43. For those of you who do not know, IVF is in vitro fertilization, where they take the eggs out after you have been what we call superovulation using drugs
Mm.
to create lots of follicles, eggs, and then you suck them out through a surgical procedure called retrieval. And in her case, she had 13 follicles growing on each side at 43 and no one said anything. And I said, you know what? There's a high likelihood that you have PCOS, but because you're a little more mature, it may seem like a, really good number.
A great
But
response, right?
yeah, like, wow, what a great
Yeah.
responder. But it's
Mhm.
like, could it have been that it's PCOS? So, I just threw it out there.
It's a tricky one, isn't it? Because it's certain people, certain practitioners, certain clinicians, this from the reproductive endocrinologists that kind of have a little bit of a little beef with the name itself, and like, is it polycystic? Is it multifollicular?
Right.
What do you call it? And there's going to be some of those that will have the other symptoms, but actually not present with multifollicular ovaries.
That's right, exactly. So I guess this is a segue to what the heck is PCOS really?
You know, only only during the last week I realized that actually in North America you don't have as much confusion, or at least you follow one of the criteria for the diagnosing of PCOS. Whereas here in Europe, it's still quite open. Although, so to give you a little bit of the background, there's three different criteria for diagnosing that people can, practitioners can follow the criteria, and within those they have three different aspects, and you have to have two of those,
Right.
right? One of them is quite old. I know this sounds terrible because it's from the 90s. Oh my God, it's quite old. But one of them, not many people use anymore. Not many practitioners use that one anymore. And from the other two, I realized because of being there, but in North America, they don't really use the Androgen Society one that much. But here in Europe, you actually do. So there's a lot of, if you don't have this, then it's not PCOS. Don't worry about it. And those two are still quite used. So basically, you would have to, the main difference with the androgen society is that you would have to have, show high androgen levels in your from your blood tests, right?
Right. So that's male hormones.
Yeah. So they would always be looking at, especially with the testosterone, and you can see the risk there. Just kind of leave that one aside. You can see the risk there because those women are more likely to be looking to get pregnant, and if they go into any state of stimulation with medication, that testosterone being high is going to mean that they're going to overstimulate.
Yes.
Right?
Yes.
So leaving that one aside, the other one is actually a mixed one. So it's from Europe. So it's the European Society of Human Reproduction and Embryology,
right,
and the American Society of Reproductive Medicine. So they got together, and I think it was 2006, but there's been a review after that. And they were looking at the aspect and saying that, you'd have to have one of the 3 points, the multifollicular ovaries, you'd have to have absence or long ovulation cycles. And which one am I missing now, Mary? Come on, being on the spotlight here.
Wait, I'm just going to go back and address what you said the first so people understand.
Okay.
So multifollicular meaning you see many
a lot of follicles.
And follicles meaning that eggs are within these follicles,
yeah.
and that's in the ovaries, and that you view it through an ultrasound.
Mm-hmm. And even within that, so for those, and we all have those patients that really like to go into the nitty-gritty of it all, and so a lot of the times, I don't know about there in North America, I don't know how things work there in Canada, but here it depends on where you get your scan done. So a lot of the times they divide your scan into the follicles that are less than 3 millimeters. They don't really pass that much remark. And then you have the next bracket of 3 to 5, and then 5 to 8, and then 8 or more. And a lot of the times you can go and, you might have absence of period completely, or you might have really long cycles and, go and do some blood tests and then go and do your scan. And depending on which ones are you then told that were seen on scan, you might think that, oh, that's actually okay. But they might have been only counting the ones that are within one of those brackets and not noticing all the other ones. Okay.
That's a great point, because it's not a consistent criteria, and it can, be different from clinic to clinic even.
Yeah. Absolutely, yeah. And yes, and as for all of them having eggs inside, that's a question that comes up in the clinic all the time. Maybe not. Maybe they're not mature. Maybe they just stay there. Because one of the issues, and like a lot of the times people want to know that in the clinics as well, how are we going to treat this? And if you go, and that's why those meetings were happening between the ESHRE and the ASRM, were how do you move on from PCOS? And a lot of the times, and again, this is going to make us sound really old, but remember the old days when the laparoscopy drilling was the solution.
That's right.
And you try to get the woman to ovulate, and then once it happens, you go like, okay, that's now you're ovulating. But those cycles would still be quite long, though.
Yeah, and so for those of you who do not know, this procedure is actually called, and this very scientific terminology, it's actually called ovarian drilling. Yeah. And the purpose is to try to invigorate and get you to ovulate again. I have witnessed some, not too many, a couple of people in the past couple of years still. So it is still being done, not so much, but it is still being done. Yeah.
So here in Europe, it kind of like things changed a lot from, moved away from that. Which, by the way, me, and I always like a good laugh, but I always say this in the clinic, that's a procedure that only a woman could do, because if you were to tell a man that you're going to do something and one of the words is drilling and it's near that part of the body, you'd go, nope, not happening.
Absolutely.
We just would not be able to do that. But it kind of moved away from that here, Mary. So here, what we're seeing more is just like to give them stimulating medication like Clomid and stuff like that.
Right. Well, and certainly that is definitely the norm here as well. But in those one-off recalcitrant cases, I have witnessed them do this. But again, definitely more of a one-off than
So for patients watching this, don't be too surprised if at one stage, between Clomid or letrozole, those were probably going to be your and with the addition, if you move on to more recently, adding metformin to it as well. or glucophage, whichever way you know that medication from. And that's
Right.
because of all those follicles there on the background. And that kind of segues into why I love it so much. All those
Yeah.
follicles there on the background are just increasing that risk. So it's almost like it's feeding its own disharmony kind of thing.
Yes, absolutely. And so the other thing I want to add, since you mentioned metformin, it's, as soon as there's an inkling insight with regards to PCOS, the fertility doctor will automatically go towards metformin. And there are some doctors now who are trying to get away from metformin and really focusing more on the root, right? And the root may be, and not for all, but for many, it's about, sugar imbalances that perhaps one can control through diet and lifestyle.
Yes.
And Chinese medicine, of course.
Exactly. There you go. So you see, sometimes people ask me that. Even colleagues of ours would ask me like, but why PCOS? Why do you have this, you live and dream and breathe this? And I'm like, look, from all the conditions, look at how good our approach is towards it.
Mm-hmm.
Right? We don't really care much about the label. So someone coming into our office and saying that, oh, I've been told that I have X, and that label being PCOS, our approach doesn't actually change that much, because we would still look at lifestyle, diet, what you're eating, what you're drinking, when you're doing it. And that is so important for a condition like this one. So I'm really looking at, can we actually find as much as possible out of this, that we position ourselves, that we can say, hey, look, you do have drugs, and it's true, Clomid and Letrozole are really, really effective. We could even see that from research.
Absolutely.
But that's kind of like almost the last resort. Like, that's really, what if you are trying to get pregnant, you're trying to ovulate, but what if you're just trying to get healthy because your cycle is all over the place?
Yeah.
What if you have the time to be on a more long-term approach, that it doesn't have to be so much like throwing petrol into that fire to get a reaction? Can we build up a little bit more and help with the quality of life? Like PCOS, actually, in terms of research, is one of the conditions that has PCOS quality of life intake that patients can fill in to say, about their symptoms and how the condition is evolving. So
right.
It's like, think about how it affects women. I remember the first year, I think, when I started the master's, and thinking about how it even impacts a woman's life. Because if you look at some of the symptoms, hirsutism being one of them, and it could really, even with acne as well, could really impact the woman as well. It's how you look.
Huge.
Right?
I mean, for a woman, listen, through the ages, women have to look good, right? I mean, you aspire to look a certain way.
Yeah.
And so to have excessive hair, to have acne, that's just heartbreaking for an individual, and certainly doesn't help your self-esteem. So it's very difficult to navigate life.
Yeah. And then it kind of goes with those comorbidities as well, of, a lot of the times you would find other, implications with thyroid and metabolism, obviously being a metabolic condition, but you would have those that no matter what they do, how little they eat, they just cannot lose that weight.
That's right.
Right. And it's really difficult. One of the gynecologists that I was working really close with here at the time in Ireland, and he said to me once that he would get women in the clinic that would be referred by their GP, and they would come in and said, oh, I was going to the general practitioner, and they were saying like, lose weight, it'll all be better. And, he was like, those women are desperate because I've tried everything to lose weight. It just won't go away. Yeah. And we know this from the clinic. They find it really easy to put on weight, but they find it really difficult to lose weight. So even for them to go on like what we would say that, oh, I'll forget about it for a night or two and just go on a chocolate bender or, whatever it is, they will put on the weight, and they'll find it really difficult to lose the weight again. And that makes them feel bad, that's right, as it would to anyone, right?
Yes. And, anyone who has PCOS, you just have to know it's not your fault.
Yeah.
And it really does make you feel bad when a person just says, oh, well, just, exercise and eat better. It's, yes, you want to eat well and you want to exercise for sure, but just know that your body works differently than others.
Yeah,
right?
absolutely. Yeah. So that was kind of like the background of it all, was even looking at when I put in the proposal initially, was looking at the long-term effects of it. If you're in a situation where you don't want to have kids, or you end up being in, it just never happens, whatever it is, it still doesn't mean that it's not going to have implications in a long-term basis. We know women who live with PCOS, it being the lean type or the overweight type, they're still going to be at a higher risk of type 2 diabetes.
Yes,
They're still going
absolutely.
to be on a higher risk of cardiovascular diseases. And, this is not something that, like before, you would hear people saying like, oh, don't worry, anything to do with menstruation will go at menopause. This one doesn't go away, because this is a
No,
metabolic condition.
that's right.
You
And
know?
yeah, and higher risk for strokes and, all the rest of that, right? And
Yeah.
and that's definitely on the rise for women, right?
Mhm.
Number one killer, heart disease, and
Absolutely.
women, the graphically for women, it's going up, whereas men is actually going down.
Mm.
So it's
Yeah.
fascinating.
So it came from that, and looking at the aspect as well of giving everyone a very happy and pleasant pregnancy as well, because everyone who knows me, and I know there's going to be people from the clinics that watch stuff on social media and whatever, they know that I've always said this to everyone who's been pregnant in the clinic. I always say, like, I don't know what it feels like, but it looks really amazing from this side. and to be able to play that little role and saying to them, look, again, same thing. If you were diagnosed before with PCOS, or if some of those symptoms are there, going into a pregnancy with them still there, it doesn't make them go away. And again, it puts you more at a risk, gestational diabetes, more likelihood of a bigger baby, meaning that you're probably going to end up with a C-section. It's just the pregnancy is not the end of the issue. It's the goal that you wanted, but what if we can play a little role on giving you a more pleasant pregnancy, giving you a much better end to that pregnancy, where it's, a natural birth, or if it has to be a C-section, let it be, but not for the reasons that, you're not even considered for a natural birth, because it's just not going to happen.
Right. So what you're alluding to, and what I hear, is it's about focusing more on the preconception and prenatal health.
Yeah. Yeah, so that's where my research comes from. So I'm looking at it from the point of view of a systematic review. So basically, like, looking at the research that is out there and just putting it all together and seeing even from studies that might not necessarily have been looking at the PCOS aspect of it, because women might have been getting treatment because of a metabolic issue, but seeing for those who were getting acupuncture, was there any change with their insulin levels? And by trying to have an effect on the insulin resistance, therefore, it's almost like doing with our magic needles what the metformin would do on a long-term basis, right?
Right.
So, yeah.
So what are your findings so far?
So
I know you're in the midst of it. So
yeah. One of the main things that has changed in my clinic, even from early days and from starting to look at research like this, is looking at research for example, from Professor Elizabeth Stenner-Victorin, and having the chance of talking to her, and definitely what happened here in the West about doing the treatment once a week, that is not really going to be enough for a condition like this.
Yes.
Okay, so I know that there's going to be all the there's all the talk about the finances and how many times the woman can get to the clinic and whatever, but in reality, for a stubborn and a sticky condition like that, once a week is going to be almost impossible to deal with it, independent of all the other side stuff that you might be and should be doing, right? Like the eating well and the exercise. It depends, because if they're on the lean PCOS, exercising more is not going to help them. That's right? So that was one of the things that it really changed in my clinic, was, first of all, the treatment, like, how regular do they actually need the treatment? And sometimes, like, once a week, for example, like a once a week stronger treatment doesn't beat like 2 or 3 that might be milder treatments during the week. but
Yes.
a continuing push on that, and you could easily see that even from Elizabeth Stenner Victorian, and saying that, do you go there and do you just manipulate the points, like some of those belly points would have been just manipulated, or would you actually add electric acupuncture? And you go like, well, add the stimulation, because that's going to give you way more movement to it.
Right, right.
So,
and so let's review, what is the purpose of the acupuncture in all this?
So one of the things that they were trying to do, and you still see a lot of that with the local points, you're talking about points in the belly, around the belly area, is just really increase that blood flow to the area. You really, really want to make sure that there's, again, going back to that basis that a lot of these women are trying to get pregnant, right? So we don't leave that aside. We still, within the treatment, we still accommodate that whenever that period, that ovulation is going to happen. That means that you want to get a better cycle. You want to get a better menstrual health. That is the main thing, right? And you still need to focus on that area. So your acupuncture is really going to focus on the ovarian work, like what the ovaries are doing. Because it doesn't, for us, it doesn't, and this is another good point for us, is that if there's a lot of follicles there, we want them to, and if there's some of those tiny ones, so we want at least one to become the dominant follicle, and we want that ovary to ovulate. So you want that follicle to burst and release the egg, right?
That's right. Yes.
If you're on the other side and the shiny ovaries and just nothing there at all, then you want to produce more follicles, and you want to get to a point where the woman ovulates and then try and reset that menstrual cycle as well.
And so again, like, what does the increased blood volume do going to the ovaries?
You want as much of that goodness to get there, right? We don't want to start using all the terms that we have, but just think about it. It's one of those things that anywhere else in our bodies, like sometimes I say to people in the clinic as well, it's a bit like, whenever our joints are cold, or like even whenever our hands are cold, and you just rub them together and you get a little bit more blood there, and you go like, oh, that feels better. When you sit in the same position for too long, and then you move about and you go like, oh, that feels better. Just getting a little bit more of that blood flow to the area and just trying to release, just trying to get it move. It's a very, for a long time, there was a thing about, you would always, in our way of talking, like you would say that PCOS equals damp and phlegm. It was like very sticky, and it's not, we now know that it's not just that, but it is still that sense of things need to move, like you're stuck in time. Here's what I really love about language, and people know this about me with being Portuguese and living in Ireland and speaking English and whatever. how the languages have different ways, and sometimes like the different words to explain the same thing. But so one of the things that happens with the ovaries that have all those follicles there, like there's so many of them, and there's so much, the body's still releasing FSH because that follicle stimulating hormone is still trying to get one dominant follicle. But the LH, the luteinizing hormone, the one that you pick one on your ovulation stick, it's just not happening because there's just too many. It's almost like there's too many of them just there, but nothing is happening.
Yeah,
right?
It's like a traffic jam.
Yeah, exactly, right? And from our side, we were talking about, PCOS, it's damp and phlegm, and things are stuck there. And sometimes people go like, what do you mean stuck there? What do you mean about stagnation? You go, like that. It's just stuck there, and it's not moving on to the next step, right?
Yeah.
And we, looking at that aspect of a healthy menstrual cycle is that's what it, the menstrual cycle is a process. It goes from the highs and lows, the high on the estrogen, the high on the progesterone, and then it repeats itself. It's a cycle. So getting more blood there, trying to get that blood cycle going, getting to a healthy menstrual cycle, remembering that if that cycle has been quite long, and sometimes these women with PCOS ovulate quite late, that lining,
or not ovulate at all,
or not ovulating at all, right? But if that cycle is long, that lining might not be the best lining for an implantation to then move on.
Mm-hmm. It's a
so
whole
just,
cycle.
trying to get more, and especially when you look at the start of the cycle, right? So when you look at the at the bleeding time of the cycle, that's where you really go strong with your acupuncture and your herbs, and just try and move as much of that old lining as possible.
Yeah, I always say that it's like discharging, getting rid of the old, and then start fresh, and bringing in oxygenation and nutrients, and
Yeah,
just to juice up those little eggs and make them
yeah,
as healthy as possible. And and with that also helps with normalizing the reproductive hormones to
yeah,
help move the eggs, as you say, along this cycle, because as we know, it goes through folliculogenesis. And for those out there that do not know, we don't just start with eggs that just sit ready to go and pop
mm,
out once a month, right? They have to develop out of germ cells.
mm,
And a lot of people, they just visualize, because the doctors actually feed into this. Oh, you have as many eggs as you're born with as many eggs as you have, and that's it. So the visual is that it's just ready to pop, right?
mhm,
Every month. But
yeah.
really, they still have to come into fruition.
Absolutely, yeah. And you see, this is where I get so excited about it, because in our medicine, this is what we do. We do things with time. We don't actually have the tools to make things happen right here, right now. Like even you could argue that, it could give someone a treatment that is coming in with pain, and then after a while they feel a little bit better. But was that really the cure to that problem? It's like the analgesic effect for it, right? But with this condition, and the fact that we also approach the diet and the lifestyle, and if we have the time, and I totally appreciate the fact that, listen, if you have someone who is over 40, or whatever condition that has happened before, and they say that, oh, I want to go into the IVF clinic on the next cycle, that's fine. You have to respect their decision. But if you have time to work with someone, having this little bit of time to improve that menstrual health, improve the ovary structure and what they're doing, it's going to not only make that cycle better, but it's going to have so many implications for the pregnancy and later in life as well, with lowering those risks, as we were talking earlier on.
That's right. So specifically speaking, then, when should a woman start the acupuncture?
Ooh, yesterday.
Exactly, right? Yes, no time better than
Mm,
today. Um, and I always say, because people will say, "Oh, well, can I do it with IVF?" Absolutely. Can I do it
yeah,
before IVF? Absolutely, right? It's
yeah.
like no matter what stage you are, no matter where you're at, no matter if you want to just try naturally versus you're already at the fertility clinic, just start now, because we're wanting to impact your little eggies.
Yeah, and right, and look at how good again we are in this position, that we can do it without, because you're not taking in anything that is interfering with any of the medication. It's like, yeah, go for it. I have a very, very funny story, like really, really quick, from before. This was from a consultant in one of the clinics that we work a little bit closer here in Dublin. And this patient, I was seeing this patient for a while, and all that, and just before the transfer. So it was a transfer treatment that the consultant said to her, and she said to me on the phone, so I spoke with the consultant, and we have the time for the transfer, but she said, can you see me pre and post transfer? And I was like, pre-transfer? Okay. I was like, that's a bit odd. Normally don't really see someone like pre-transfer. Like, normally what would happen is you go to the clinic, and then after the clinic you go to the IVF clinic, and then after you come to see us, or depending on being a 5-day blastocyst or whatever, it might be then after that. But I was like, it was in my mind, but I was thinking, okay, if the consultant said so. The thing was that I couldn't see her. I could see her before because I was in a different clinic. So I said, I could see you before, but you'll have to go to Siobhan's clinic after, because then I'm going to have to travel to go to the other clinic. And that was all fine. But when I said it to Siobhan, I said, look, there's a patient of mine that you're going to have to see post-transfer. I will see her before, but you will see her after. And Siobhan was like, why are you seeing her before? And I said, I don't know, the consultant said so. And Siobhan was like, and you didn't ask? I said, I don't know, the consultant said that she wanted her to do acupuncture before. And I was like, yeah, okay. She's like, oh, but you should ask, because we have to know. It turns out that the reason why the consultant wanted the acupuncture before the transfer was because during the collection, they have noticed that her cervix was really, really tight and she was a bit tense.
Okay, so you mean the retrieval, not the transfer.
So yeah, during the retrieval, the consultant
Okay.
had found out that the cervix was a bit tight and a bit too tense. So the consultant told her that before the transfer for her to get acupuncture as well.
Yes.
And I was like, so when people say, when should I do it? I'm like, I don't know, when can you come in?
Yeah.
Why are you
so
doing
true.
it for? You know?
It's true. There's so many different reasons why we do utilize the acupuncture and for different times. So it's like, no matter what, like you can come in and do it, right? So we certainly treat people any old time through the cycle.
And you see, like, this is one of the examples of, you know, there's more and more people out in the medical fields knowing about what it can do. And a lot of the times, you know, you have that thing about, oh, you know, what does it do? Is it just for relaxing and whatever? And I always say, look, what if it's only just for relaxing? Would you do it? You know, at a time like we're talking about that time, you know, around the collection and the transfer, it's quite stressful for both in the couple, right? But
absolutely,
what if it's only doing the relaxing? Would you still do it? Like, would it still be worthwhile if the only thing was that it's relaxing you? And a lot of the women would say, yeah, like it's too much, you know, all the medication and all the getting ready and all, you know, all the build up to that moment. You know, there's you know him as well, John McDonald. Recently, we were chatting, and he said that it really grinds my gears when people say that, oh, we don't really know how acupuncture works. And he's like, we don't know how acupuncture works. We know way more about how acupuncture works now than we did ever before.
Absolutely, yes,
like,
and
that's a very good point.
and you know, coming from a personal perspective in terms of the relaxation response, it is so critical because, you know, how do we navigate our lives without being able to persevere and endure? And, you know, like if you're over the top stressed, you wouldn't even be able to make it to the clinic, let alone like get out of bed. Right. And we know, clinically speaking, there's a high incidence of depression and anxiety associated with women going through the stress of the fertility clinic. So if we augment that, how can we not help? And Dr. Paul Magarelli also addresses this too, in terms of contribution to infertility. You know, there is an aspect of depression that can contribute to negative outcomes for fertility.
Yeah, see, you mentioned him, and one of the things that always clicked in my mind, and you know, why am I approaching PCOS from the insulin resistance side of things? I always think about how we approach it from the prolactin and the cortisol side of things as well. And I was like, look at how important those are for what the final goal is. Right. And it's the same principle. You know, sometimes you can't just, one of the teachers over in Beijing used to say to us there in university that sometimes, like breaking this big rock in front of you, if you go and you start hit the middle of the rock, it's just not going to work.
That's
you know,
right.
Your hammer is it's too small. You can't impact there. But if you start chipping away at the sides, bit by bit, you're going to break it down.
Yes. And that's us TCMers in the field of Western medicine. We're breaking it down bit by bit so that we can have integrative medicine.
And I love it. Look, Mary, absolutely love it. It's one of the biggest things that I really appreciate when there's collaboration like that. And I really love, you know, having the opportunity of knowing more and more people, not just in the US, but also in Canada, and seeing it can actually be done, and it should be done in an integrative way where we're all helping and we're all supporting, you know, and that is really my approach to this particular condition, is that I'm not saying, and you probably notice in my language, I'm not saying that acupuncture and Chinese medicine is any better at treating PCOS. I'm just saying that our approach to the whole person and what they're doing, and not just the condition itself, favors a condition like this.
Absolutely.
And if we can play a part in helping, it being with the insulin resistance, or it being with, you know, the FSH or the LH, or just helping with ovulation, so be it. You know, whatever it is that we can do to get the woman to get to the result that they want quicker, you know, it being healthy or the pregnancy, and then having a healthier pregnancy, I'm all for doing it together. No problem at all.
Yeah.
Love it.
Well, I love it too. So thank you. And I can hear your enthusiasm, and that's what we love. You know, yesterday I was just saying, every day I go to work and I feel so honored and
Mm.
grateful. Despite any kind of challenge in my own personal life, I walk in and I thought, God, I'm so grateful to be here, to be able to help guide women and couples in the way that we do and make a profound difference in their lives. It makes it meaningful for us in our field, right? Like to
I
be able
think
to,
that that's a key point, the profound difference for their lives. And that's what I really like about our approach is that, hey, listen, you have an opportunity to, no disrespect to medication, you can get there quicker. Remember when Paul Magarelli said that with Western medicine, we can get there quicker. And he said, but you guys with a Chinese medicine, you can get there better.
absolutely. Yeah.
And if you want that quick result, and it's a bit like going to the gym, right? And if you want to take all the pump up steroids and whatever, you will look like it. Will you really feel like it? And is it sustainable? Is it
And is it
healthy?
sustainable? Yeah.
Or you can take time. And as I can't say this enough, like for pregnancy, it is such a big deal. And it really breaks my heart to see a woman going through pregnancy and not enjoying it as much because, they might still need medication. They then get into a point where they're told, well, you have gestational diabetes now. It's just it really breaks my heart. I just want happy pregnancies all along, the glow of pregnancy, right?
Yes, yes. And I really, really appreciate you mentioning more and more about the prenatal period during
Mm,
pregnancy, because what happens often, there's so much focus in getting pregnant
mm.
that women kind of forget. It's like, okay, I'm pregnant, now I can just run away. And then they disappear. And
Yeah.
then yet it's like, wow, it is so important to help you along during the prenatal period so that you have a really healthy outcome,
Stepping
right?
stones, right?
Yeah,
Stepping stones. And knowing, having more of that. We all do wrong things. Remember, we spoke about this before, and even in the clinic, I mentioned that I was talking to you about probably a year ago or so, and I mentioned that chocolate cake theory that, you don't want to eat it, and you're like, oh, I shouldn't do it. And, you're eventually going to do it anyway. So you might as well enjoy it, right? And
right.
I, it's a bit like that, we're all going to have that chocolate cake day. But can we position ourselves in a way that that chocolate cake day does not interfere with the rest of the work that we're doing, And sometimes it's tough, I get it, coming to the clinic, 2 times a week and, having to take the herbs and having to remember to take this and having, you might have medication that you're taking as well. And there's all the stuff that, don't do this and don't do that,
Yeah.
but it's for the greater good. And we're here to help. I'm sure, like myself, like you get the emails and you get the texts, and we just love to help people, and we love the journey more so than anything. I actually love the journey because I love to see, looking back on where that woman started and
Mm.
then where they are then after. It's like, that is really cool. You look back now and look at how much has changed, so
Absolutely. And it
yeah.
gives us the confidence to share with these women. It's like, hey, listen, you know what? We actually witness this every day. We see the despair, right? And then we see the birth of themselves before the birth of their child.
Yeah.
And the transformation is so incredible and such a privilege to be able to be part of. And in my own personal journey, and if you're interested, for those of you out there watching, you can read it through my book Pathways to Pregnancy. But I was there, and who inspired me most were my patients,
Yeah.
because I did watch them go from this desperation to this joy. And I'm like, you know what? And instead of having it drag me down, it's the opposite. It's like, I get to witness this birth of miracles, and
Mhm.
one day that will be me. And
Yeah.
that's why I wanted to share the stories.
And how many people in my clinic have read your book and, from the stuff we did before for the vlog, and they really loved it. And yeah, like one of them I can remember, it's like every time that I think about, oh, just, it's enough and I'll give up now. It's just like, no, I'm not giving up. There's other people that have gone through this and they did it. I'm going to do it too. And it's
Yeah.
just, sharing our stories. And to a certain degree, like I can understand and just kind of like pulling a little bit towards the research, I can understand there's people out there, particularly in our fields, that go on, we spoke about this briefly, the, acupuncture, can it be researched, and Chinese medicine, can it be researched? But to me, I see it a little bit like you putting, everything that happened to you in the book and sharing with others. Others can now pick that up, do their own research, get information from it, and go, oh, I'm going to build up on this.
Mm-hmm.
And I know it's the cliche of standing on the shoulders of giants, but it is really like that. I feel that just like it happened before with other researchers and other practitioners, and even in China with lineages and going from one family to, from the dad to the son and so on.
Mm-hmm. Mm-hmm.
I feel really privileged that I can now go and know a little bit, that I can read information of what other people were trying to do and get the juice out of that and use it in my clinic as well.
It's
And
so great.
That's what I see about research, and that's what I see about reading books, and that's what I see about doing this is,
Yes.
I said it to someone the weekend that I'm not afraid. At the start, I was afraid of being wrong because, you're just starting in clinic. Now I'm just afraid of being right. So you see the people in the clinic and you go like, oh, I don't want this to be, conditioned, whatever, because it's going to take time and whatever. I don't mind being wrong.
Mm-hmm.
I don't really care. I'm doing the research and I'm doing what I love because I want to share, just like yourself, like what you were saying, and getting more people involved. And not everyone's going to be involved, but if you get the right ones behind, like what you're doing and sharing as much as possible, doing this, you wrote the book, you're in the clinic, you're busy. It's healing the community.
Yes. And so really the point of all this is you're not alone, and there's a community of help in many different directions. So I think we've talked a long time. So I really appreciate your time and your energy and your passion and your commitment to helping to heal the world. And the great thing is, again, we are a community, and I love that. And it's no longer the lineages in privacy, right? We share our knowledge, which is so beautiful. I think it will create more of a profound effect for the future of our medicine and the impact that we have. So thank you. And I can't wait to see you in a couple of weeks, I guess.
Yeah, like 3 weeks, 4 weeks time. Hugs all around. And that's amazing. So you see the sharing and getting to connect with people, like look at how many thousands of miles away you are, and we're still able to connect, use the technology. If not that, like what you did, write a book, put it out there, write a blog, put it on your website, just get more and more people involved, because it's amazing. It's an amazing journey.
Absolutely. So if anybody wants to get in touch with Sandro, you can, right?
Yeah, absolutely. Yeah. Like I love it. Absolutely love collaborating, and just sometimes just like even just talking about it and getting different ideas. So absolutely.
Okay, great. So reach out to him, reach out to me. What's your email address or your clinic maybe?
They can get, so the clinic website is acupunctureclinic.ie, and my email is sandro@acupunctureclinic.ie if anyone wants to get in touch.
Lovely. Thank you. And certainly you can get in touch with me as well. I'm w@aliveholistichealth.ca. And if, again, you haven't had got my book yet, you can actually go to marywong.life and download a chapter for free. So you can start with that and scroll down. There's lots more videos. Now, we mentioned metformin. I did an amazing, and if you haven't seen it, Sandro, you should watch it. I interviewed RE, and he talked about not using metformin as part of his. So you've actually seen it?
Yeah,
awesome.
I was looking at it. Yeah, pretty good.
Okay,
information
he's awesome.
For patients, amazing.
Yeah. So if you haven't checked that out, scroll down. I don't actually remember the post number, and if you're too scared to be known at any way, shape, or form through Facebook, then you can also subscribe to my YouTube channel, which is like 2 people on it, but that's okay because it's totally private. So go on. And if you look up videos through my marywong.life, you can subscribe there, and then you can just upload or whatever, watch in your own time, any of the videos, like 122 videos. We've got a lot of information and really good information. All right. So again, thank you, Sandro, and we'll see you in a couple of weeks. And next week, guys, join in, and I'll be actually interviewing one of my former patients. And I just love her story because, there's different family building procedures, and this is a challenge through a same-sex couple, but, it's the same challenge as for a single woman. and navigating systems. So I think that'll be a really interesting chat, and as well, how she overcomes her challenges. But you know what? That is also shared for us heterosexual couples. So really, we're not all that different. But so tune in next week, and we shall see you then. Okay, take care. Have a great day and night whenever you're watching this. Bye.
Bye.
See you, Sandra. Thanks again.
Thanks.